We were so thrilled with the announcement of Simone being appointed as the Deputy Secretary Operations. She's absolutely a great supporter of practice and we're thrilled to be working with her.
So the number of children involved in child protection is growing. So even though we've had a reduction in the number of children entering care in the last 18 months, more than ever we need better supports for children as well as their families, their kin, their guardians, adoptive parents and their carers. So just to think about the stats around out-of-home care, in 2006 there were 10,623 children in care, and that rose to 18,659 children in 2016, a massive jump. The length of stay in out-of-home care increased by 22% since 2010, and children and young people spend an average of 12.5 years in care. Aboriginal children and young people we know are overrepresented. But if you think about the fact that 5.4 people aged 0 to 17 are Aboriginal, but they make up 37% of the out-of-home care population, you can see the size of the overrepresentation. In the last couple of years, I was involved in a piece of work reviewing out-of-home care, and we spent a lot of time working with central agencies talking about the cost of care to government. And what we discovered is that if you're an Aboriginal boy in out-of-home care and you have one contact with police, literally a caution, it doesn't have to be anything more than that, then over the next 20 years, your cost to government will be $1.2 million. Now, the cost to government is one thing that it's fine to discuss with Treasury, but actually what I'm really interested in that stat is the experience of that young Aboriginal person, because that's primarily going to be costs that are associated with incarceration, juvenile justice and corrective services. And that's the important part of that story, which makes today incredibly powerful. So the Permanency Support Program's been developed, as Kate mentioned, to support government and non-government agencies and practitioners to really achieve permanent and safe care and safe homes where more children can live happily and also thrive. It recognises wherever possible that children will do their best with them to keep their families together and that they can stay safely. The implementation of the Permanency Support Program is one of the most significant changes to child protection in out-of-home care system in decades. And what it does is really build on the broader suite of reforms that you may have known about through their Futures Matter, but also takes us back to 2014 when we had really significant legislative change, where we absolutely enshrined in legislation that long-term care, parental responsibility to the minister was our least preferred position. And the work that we do today and the work of the Permanency Support Project and Program really puts the meat on the bones of that legislation and gives us the how. The four main components of the Permanency Support Program are permanency and early intervention principles being brought into casework, working intensively with birth parents, families and kin to support change, a new approach to recruitment, development and support of guardians, adoptive parents and other carers, and the intensive therapeutic care system reform, which, for those of you who haven't heard of that, that is the new name for residential care. Permanency Support Program provides the opportunity for a greater focus on early intervention and intensive support to keep families together. So this means really tailored case planning for each and every child and young person to provide the pathway to permanency. And what that's going to require is incredibly good quality practice, which is, again, why we've referred a number of times to the practice framework, because we think this gives us the tools and the mechanism to build that quality work consistently. So you may know that the New South Wales government's committed $90 million over 4 years to help 900 children per year through intensive preservation and restoration services aimed at keeping families together. And half of those 900 places will go to Aboriginal children. So they're the multisystemic therapies and family functioning therapies that you may have heard of. Yesterday I was up at the Hunter and speaking to the manager client service from Edgeworth. They were saying that those families that have gone into their family functioning therapy program are just at the cusp of being reassessed and that their risk has reduced. So that a number of the families have gone from very high risk to moderate. And so that is a speedy change, and what we're looking for is sustained change. But it felt positive that even in these early stages we can see the difference. So where early intervention and family preservation has not been able to prevent the entry of children to out-of-home care, restoration is absolutely the next preferred permanency outcome if it can be achieved safely. So restoration aims to exit children from out-of-home care and return them to the care of their parents or their family or kin, where they have demonstrated that they are or that they are becoming capable of ensuring the safety, welfare and well-being of their child. So it involves a couple of things. One is the children's court orders that allow sufficient time for parents and their family or kin to make necessary changes in order to reduce risks that led to the child entering out-of-home care, and a restoration care plan that describes the minimum outcomes that must be achieved before it would be safe for a child or young person to return to their families. So this really needs to specify what has to happen and the timeframes which restoration should be supported to occur. I guess I go back to what Kate said, that there's a level of transparency required in that work as well, is that we need to be really clear with families about our expectations and hold ourselves to account as well. Through previous reforms, we've often talked about moving the goalposts on families, and this reform really works hard to make sure we're transparent and that we're clear with families about expectations. So FACS is introducing new tools that support assessment and decision making, and Elaine's going to talk about these towards the end of the day in the discussion with the restoration tool. So the tools consider the level of risk that's inherent in restoration, and I think it would be Pollyanna to say anything else, that there is inherent risk that sits in this work, but also talk about how to progress families towards their case plan goals. The research highlights that common characteristics of effective restoration programs include increased contact between workers and parents, parent contacts with children, parent skills training, mental health and substance abuse services for parents, concrete services for families, and social support networks. So the research does suggest that these services decrease the amount of time that children spend in out-of-home care and can improve family functioning. And effective restoration services offer intensive casework in the home, adopt an individualised approach to working with families and the case planning. But there's a number of other factors that's also associated with improved restoration, one of those being caseworker stability. So the literature confirms that caseworker stability contributed to the likelihood of achieving restoration, particularly if a child has one caseworker who remains with them over time, which I think we would all acknowledge can be difficult in any child protection environment that we're working in. Caseworker turnover has its greatest impact in the first 3 years. As the number of caseworkers increase, the percentage of children achieving permanency has been found to drop. The other thing that makes an impact is proactive social work practice, playing an important role in successful restoration. So the other thing is that the research is also really clear that agency collaboration is critical in supporting positive restoration outcomes, and it's great to see some of our NGO partners in the room. One study in the UK found that the involvement of another agency in helping public agencies supervise children during restoration and in bringing them home was 4 times more likely to be stable than when this was not the case, which tells us again back to the practice framework where we talk about purposeful partnerships is not just working together, but the intention that we want to achieve through working together. And also the suggestion that none of us can do this on our own. So we'll continue to work with the districts and the OSP to identify further supports that caseworkers need, to identify the most suitable case plan goal for children, because the permanency support program is absolutely built on the success of that casework. To create a package of support that is tailored to a child's needs, to regularly review case plan goals, assist children and young people to reconnect with their family, and enhance cultural competency.